Hello. In this video, we will be going over the basic process you can use when seeing primary care patients while working in remote practice. Remember those 4 key resources from our earlier video? The assessment form, the decision support tools, or DSTs, the clinical practice guidelines, or CPGs, and the BC formulary? This is where we will bring them all together to form a picture of what your history, assessment, clinical decision-making, and charting should look like. Before we begin, I'm going to give you a quick visual to differentiate DSTs from CPGs since the titles are so similar. Here's what I'm referring to for DSTs, which are BCCNP specific, and the CPGs, which come from Health Canada First Nations Inuit Health Branch. So a patient presents to the clinic, and you bring them into the exam room for assessment. You complete your history and physical exam. Don't forget the handy assessment tool that you can use to make sure you aren't missing key areas to include in your assessment. Once you complete your initial assessment, you will need to check the decision support tools. By this time, you will likely have a tentative working diagnosis and will need to see if any of the DSTs contain a section for the health concern. If they do not, you will then move on to check the clinical practice guidelines, which we will go over shortly. If the DSTs do contain a section for your diagnosis, you will need to go through and check to make sure there's nothing further that you need to assess. If there is, go back into the exam room and do so. Here are some examples of information in the DSTs that can be very easy to overlook, but you have to assess for because they inform your scope of practice, your course of action, and what you'll be required to reflect in your charting. On the left, if this patient has had treatment for UTI within the last month, it changes the clinical picture from uncomplicated UTI to complicated UTI. And for anything that falls into the complicated UTI category, you are required to consult regardless of if you have your certified remote practice designation or not. Next, did you remember to ask the patient if they have diabetes or any other health history that might affect their genitourinary system? This will be an important thing to note in your charting under past medical history. Under your history of presenting illness, are there any of these things you did not specifically ask about? If so, go back in and assess. Finally, your physical assessment. Again, and you'll get tired of hearing me say this, but if you don't take anything else away from this video but this one point, I will have succeeded. You have to assess for and chart everything in this section as well. And again, there are things here that, if positive, such as flank pain or CVA tenderness, change the clinical picture and will require you to consult. Okay, I know that last slide was super busy, and you're probably thinking, I really wish I didn't watch this video. But the good news is, everything you need to assess for and chart is in the DST. Basically, it's a cheat sheet for primary care and remote practice. This is the standard for care, helpfully laid out in black and white. So your next step is going to be the interventions. If you're remote certified, you can go ahead and dispense as per the recommendations in the DST. But don't go anywhere yet, because this next step will apply to you as well a little later on in this video. If you're not remote certified, your next step is to check the BC formulary. Find the recommended medications from the DST and cross-check them against the codes provided in the formulary. Remember from our scope of practice module, there are a number of medications you can dispense without a remote certified designation. These are A, C, and D categories. Anything apart from those, you will be required to consult a physician or NP for. If you're working with an RNC, unfortunately, they are not able to give you orders to dispense medications that are outside your scope of practice. They would have to go in and assess the patient for themselves, basically assuming the care for that patient. Okay, so what if your patient has a health concern that's not in the DSTs? This is when you would access the CPGs. Please remember, always check the DSTs first as they are BC specific. The CPGs are for reference only and do not determine what is in your scope of practice. They will, however, be able to guide your history and physical exam, give you important information on when to consult, and help you anticipate what orders you might expect from a physician or NP. Next, you will need to check the recommended interventions against the BC formulary. If they are advising something that an RN can give, categories A, C, or D, you can proceed with dispensing. If, however, such as the Toradol in this example, it falls into a B category, you will need to consult. If it falls into an E category and you are remote certified, this point is really important, you are not able to dispense that medication. Remember, your scope of practice as a certified remote nurse is determined by the BCCNP DSTs, and you can only dispense medications in the E category for health conditions found in the DSTs. So in this case, if there was a recommended treatment listed as E in the CPGs, you would be required to consult. I did want to mention one really awesome feature of the clinical practice guidelines. Because they've been written with a strong background of nurses in remote practice, there are very helpful sections on when to consider a medevac. In this example, there are some very clear indications for when it would be advisable to consult regarding a potential medevac for back pain, which, let's be honest, can be pretty gray sometimes unless there are very obvious trauma indicators. And this is where a lot of remote practice falls, the gray areas. It isn't the cardiac arrests or the compound fractures or the fish hooks embedded somewhere that require a high level of diagnostic reasoning. Where these guidelines are essential is so that you know to ask in your health history about any of the red flag indicators. We don't expect you to know what each of the red flag indicators might be, but we do expect that you check the guidelines and assess accordingly. Okay, so that brings us to the end of our video on the process for primary care in remote practice. We hope that you found it helpful, and if you have any questions, please let us know.